Lyme disease, symptoms and causes. Lyme disease is a bacterial infection transmitted to humans through the bite of a tick with the infection. Deer ticks are the primary source of the bacteria that cause Lyme disease. Anyone can get Lyme disease. But you're at greater risk of getting a tick bite and potentially infected if you spend a lot of time outside in grassy or woody areas. Ticks may bite and latch onto any part of your body but prefer hard-to-see spots like your scalp or groin. Infection usually occurs when the tick stays latched on for a few days. Lyme disease symptoms vary, but when left untreated, the bacteria can spread to the heart, joints, and nervous system. What are the symptoms of Lyme disease? Lyme disease usually starts as a red rash at the site of the tick bite. This rash may appear 1 to 4 weeks after the bite. It starts small and expands, looking like a bull's eye. Other symptoms of Lyme disease include fever, headaches, fatigue, muscle aches, joint pain, memory loss, difficulty concentrating. When left untreated, the bacteria may cause neurological problems like Bell's palsy, paralysis of the facial muscles, or meningitis. Some people may even develop psychological symptoms like depression or anxiety. Early diagnosis and treatment increase your chance of a full recovery from Lyme disease. Causes. Lyme disease is caused by Borrelia bacteria. In North America, the black-legged tick, also called the deer tick, mainly carry the bacteria. In Europe, a different species of Borrelia causes Lyme disease. Ticks carry the bacteria. These ticks are known by a few names, including castor bean tick, sheep tick or deer tick. Tick bites. Ticks feed on blood by attaching to a host's skin. The tick feeds until it's swollen to many times its typical size. Deer ticks can feed on a host's blood for several days. Ticks pick up bacteria from a host, such as a deer or rodent. They don't get sick, but they can pass the bacteria to another host. When an infected tick feeds on a person, the bacteria can move to the person's bloodstream. The bacteria are less likely to spread Lyme disease if you remove the tick within 24 hours. Both young and adult ticks can carry the disease. Young ticks are tiny and hard to spot. You may not notice if a young tick bites you. Risk factors. Your risk for getting Lyme disease depends on if you spend time where they are likely to live. This includes the region. Deer ticks that carry Lyme disease are widespread. They are mostly found in the upper Midwest, the northeastern and mid-Atlantic states, and in south-central and southeastern Canada. The castor bean tick is found throughout Europe. Habitat. Ticks live in wooded, shrubby or grassy areas. Time of year. The risk of infection is greater in the spring, summer and fall. But ticks can be active anytime the temperature is above freezing. Complications. Some people with Lyme disease report symptoms that continue after treatment. These longer-lasting symptoms may include arthritis that begins with Lyme disease and doesn't improve, body aches and pains, constant or frequent tiredness, memory complaints. These conditions are not clearly understood. Some people with these symptoms may be diagnosed with post-treatment Lyme disease syndrome, or PTLDS. These long-lasting problems may be caused by incomplete treatment, reinfection with Lyme disease, immune system response to fragments of killed bacteria, immune system activity that harms healthy tissues, also called autoimmunity, conditions other than Lyme disease that have not been diagnosed. If you suspect you have Lyme disease or have been bitten by a tick, it is crucial to seek medical attention for diagnosis and appropriate treatment, usually involving antibiotics. Early detection and treatment are key to preventing the progression of the disease. Visit the link in the description below for more information.